Do you have hunched forward posture? Maybe you have a neck hump or forward head posture, or maybe you have all three of these things. In this video, I'm going to show you 3 movements that can get rid of each of those things or all 3. Stay tuned. Oftentimes, these 3 postural patterns, a hunched forward posture, a neck hump, and forward head posture, will often be present together. This video is going to help you if you have 3 of those problems, 2 of those problems, or just 1 of those problems. In 3 movements, I'm going to show you in the comfort of your home how you can start to correct your hunched forward posture, your neck hump, or your forward head posture. Let's get to it. Okay, let me just show you quickly what this posture pattern looks like. Oftentimes they're found together. That's when a normal posture, your back starts to hunch forward, your neck starts to move forward and developing a hump there, and then your head shoots forward as well. So what your postural pattern turns into is something like this. So as we lie you on the table, let me come around here. The first exercise is going to be to reverse this. And so everything I'm going to show you today is to do the mirror image of this postural pattern. So what we want to do is we want to extend up and pull back the spine to a more neutral posture. And that's what this first exercise shows. Let me show you right now. Okay, I want you to get on the floor and do these with me. So you need a flat surface. It could be a firm bed, a yoga mat, a carpet, just anything. I want you to lie down first. And what this is going to do, just as we lie down, it's going to extend our back up and it's going to take that hunchback out of the postural pattern. But the exercise we want to do is often done standing, and it can be effective standing, but I find when you're lying prone, face down, it's just more effective. It's called a YWT. The point of the exercise is to come up. It will extend up with our hands and then bring them down to a W and hold for 2 to 3 seconds. And then come down. So what we're doing, we're extending our thoracic spine, pulling our head back, engaging our shoulder blades, and firing our thoracic extensors, and come down. And up. And down. You're going to really feel it in this part of your lower back. You're going to feel it between your shoulder blades, in the back of your neck. Just visualize you reversing or mirror imaging the exact opposite posture and holding it. You want to hold this for 2 to 3 seconds, and you want to do 2 to 3 sets of 10 to 15 reps every day. I'm already feeling this after 6 to 8 reps here, but I'm going to do 10. Really squeeze at the top. And last one. If you did those properly, you're going to feel it. If you can only do 2 or 3 sets, or you're just having difficult raising your head up, that's your starting point. Start slow, but be consistent. Over a period of weeks, you're going to get stronger. The exercise will become easier, and your posture will improve. Okay, you should be nice and warm after that first one. I certainly am. This next one I'm going to show you is one of my favorites, and it's one I give patients quite a bit because it's really effective in so many different things. It's the standing reverse plank, or the standing reversed elbow plank. I'm gonna start with the plank, and then we're gonna engage our elbows, because that might be more effective for you based on what you feel. For this one, you're gonna need a little bit of a face cloth or some padding. Back to the wall, we're gonna take a few steps, maybe 6 inches off the wall. We're gonna place this behind our head, and we're gonna lean back into the wall, and we're gonna engage a nice, tight reverse plank where most of the force will be generated in the back of the neck. Now what you want to do is you want to extend the elbows back to open up the shoulders and to extend the thoracic spine. So you want this nice straight line. If this is too hard or it's too easy, then another movement you can do is you can pull your elbows to the wall and pull your head off slightly so that the towel is going to fall, obviously, and we're going to engage back and hold the movement with our elbows, with our head just slightly resting on the wall. This does a little bit more of the thoracic spine problem. If you notice that you have more of a hunched in between your shoulder blades rather than a forward head, then you're going to do this movement. If your head's forward and you have a neck hump, you're probably going to do the head more than the elbows. If you have both, you can engage both. Now, this movement needs to be, you need to concentrate for this movement. You need to feel what you're trying to feel, engage the muscles so that you're extending, opening up our shoulders, getting your head back. It's, again, we're trying to mirror image reverse this posture with firing the correct muscles the right way. You're gonna start holding this for about 10 to 15 seconds per set, and we're gonna work up to about 8 to 10 sets a day. If this is easy, then you can extend that hold up to 30 to 60 seconds depending on your needs and your tolerance level and how strong you are. Again, focus on the line. We want a nice, straight line from the ear to the shoulder to the hip to the ankle, and we want an angle to make sure that we're able to fire the appropriate muscles to support better posture. Okay, those first two exercises are really good exercises at targeting the muscles that will really help pull that hunched forward posture back. It'll help reduce the neck hump that's there because of poor posture, and it'll help to pull your head back, correcting all three of those postural patterns that I'm sure you're here for. These exercises are very important to help restore your posture, but without this last movement, your correction or your posture fix will be limited. We often forget about the ligaments that surround the spine, and if you were to look at this spine deep inside, you wouldn't be able to see the bones because they'd be encased and wrapped with ligaments. So the ligaments are the holding elements of the spine that really protect the spine and really allow the spine to maintain integrity as we move and to protect it from excessive motion. The problem being is when your posture has shifted so far and it's been trained to do that over and over by how we sit, we're looking at our phones, the ligaments tighten up around this. So we actually need to help stretch these ligaments. In the office, we have some specialized equipment that we give based on the needs of a patient. But at home, I know you won't have something like this. I'm going to use this to show you on the spine, but I'm going to give you an alternative that you can use at home. First thing we're going to do is we're going to get the position of this right. Oftentimes people focus on their neck, but we want to focus actually below on this blue part of the spine called the thoracic spine. And we're simply going to lie on this, and we're going to use gravity. And as our body weight comes over time, what happens is this is going to elongate the spine, really put it back in a neutral posture so that when you stand up, your posture has improved. Now, this needs to be done consistently over a period of time. Obviously, this is not a quick fix, but it's super important to add to those two exercises I just showed you. So let me demonstrate how to do this at home. So unless you've been to a chiropractor that does posture correction, you probably don't have a thoracic retrainer at home. So I'm going to put that over there, but you probably have either a foam roller, a yoga mat, something cylinder, a pool noodle. What we're going to do is we're going to place this crosswise, and again, you can do this on a firm surface. The most important part of this is getting the right spot. And so if you have a hunched forward posture, a neck hump, forward head, one of the best spots is in the apex of where that curvature would be in the thoracic spine or the mid back. So we want to get it so that it's opening up. Your legs can be straight here. For this purpose, I'm on this chiropractic bench. I'm going to bend them just to make it easy. And you want to get in a spot where your head is going to come back. It's going to open up your rib cage. You can put your arms out to the side if you want, or you can rest them comfortably on your chest. You're going to lie in this position, and you're going to really visualize that that spine is being extended in the thoracic spine and lining up your head and your shoulders. And just relax. You can hold this for a minute to start, but those keen can work up to 10 to 15 minutes. It's a relaxing posture. Just work on your belly breathing, a relaxed, non-stressful breathing pattern, and just relax into it. If you find that that is not aggressive and you're not feeling it, then what you can do is come to the edge of a bed, for example, or a couch. Same thing. And you want to just come off and just get a little bit more hang to open things up. Again, this is more of a ligament stretch than an exercise, but it is imperative for posture correction. If you have pain or a neck issue or a back issue you're aware of, I strongly suggest you seek out your local chiropractor to get more efficient and specific help with your posture problems that could be contributing to those painful issues. As well, check out my channel. I have lots of resources for you to help yourself in the comfort of your own home, like these 2 videos right here. They will show you how to sleep off a neck hump, forward head posture, or hunched forward posture. So please be sure to check those out. If you're new to my channel, explore my channel. If you like what you see, maybe you'll consider subscribing so you can be informed when I upload a new video. Until next time, stay well.